Authority told county leaders the pandemic will get worse before it gets better, especially for El Pasoans with underlying health issues. The city and county's top doctor says hospitalizations and admission to intensive care units are on the uptick. ABC 7's Michael Gordon details that new information.
Now, what we're talking about here is two underlying health conditions that have already been known to be a considerable issue in the El Paso community even before COVID-19 arrived. But the specific extent to which they've been found in those patients who have been taken by the coronavirus was especially surprising to those listening into the meeting today.
On the underlying conditions at the time of death, we see the high blood pressure and diabetes are the biggest ones. We Hispanics are known to have a higher incidence of diabetes and high blood pressure than other minorities.
This graph tells the tale. 42.17% of patient victims showing diabetes, and an even larger number, 57.82% showing hypertension. And with hospitalization and ICU admission rates increasing still, the doctor warns that things could get worse come the fall.
This way we'll be ready for October, which is the flu season here in El Paso, because that one can be very, very hard hitting our community.
The emergency management coordinator also spoke to commissioners, pointing to some positive signs, including a more stable reserve of personal protective equipment amongst hospitals and at-risk homes for the elderly.
We've been working very closely with them since March. All of our education task force went out to all of these facilities. They assessed them for PPE needs. If there were any gaps there, those were provided.
It's brought up before, but said today it bears repeating. He said there's sick people out there who are actively avoiding the doctor's office because they're afraid they'll get sick or sicker by going there, but that actually those offices, those visits, they should go through with them because they're some of the cleanest and most disinfected areas in the community. Michael Gordon, ABC 7.
Meanwhile, El Paso's 7-day rolling average positivity rate is down from last week to this number you see here, 8.93%. That's nearly identical to the overall positivity rate of 8.92%. Now, the lower these numbers are, the better. Last Wednesday, the 7-day positivity rate was at 16.28%. That represents the percent of people testing positive for COVID-19 out of the number of overall people tested over the past 7 days. Now, a good benchmark to determine how we're doing is to make sure that number stays below 10%. We'll continue to follow this important data point to give you perspective on how the impact COVID-19 is having on the borderland.